Hello future nurses. Welcome to this video series of Q&A for Nursing Fundamentals Volume 1 and 2. Chapter 3 Comfort. Question number 1. The nurse cares for a neonate who appears in pain. The neonate has tight facial muscles, loud and shrill cry, rapid breathing, tense extremities and is thrashing about. Using the NIPS pain scale, which number will the nurse give a neonate? Option A 5. Option B 6. Option C 7. And option D 8. And the correct answer is option C. The Neonatal Infant Pain Scale NIPS is a standardized pain scale used for assessing pain in neonates up to 6 weeks of age. The scale is based on facial expressions, cry, breathing patterns, arm and leg movements, and state of arousal. Tight facial muscles is 1 point, loud and shrill cry is 2 points, rapid breathing is 1 point, tense extremities is 2 points, and increased movement is 1 point, which are equals to 7 points. Question number 2. The nurse sets up a PCA pump for a postoperative client. Which safety parameters will the nurse use? Select all that apply. Option A. Dose volume limits. Option B. Partial dose settings. Option C. Dosage limits. Option D. Lockout interval. And option E. Reprogramming alarm settings. The correct answers are option A, C, and D. Dose volume limit parameters limit the amount of drug that the client can receive when the client pushes the control button. This is an important safety parameter the nurse will use. Dosage limits set the dosage limits as specified on the order. The lockout interval is set in order to ensure that doses are not administered too frequently. Question number 3. The nurse cares for a client who requires a PCA for pain control. The healthcare provider has ordered a loading dose for the client. Place the steps in order for the nurse to provide the loading dose by PCA pump. Option A. Set the safety parameters. Option B. Press the loading dose control button. Option C. Set the volume to be delivered. Option D. Set the pump for a lockout time of 0 minutes. The correct steps are option D, C, B, and then option A. When providing the loading dose by PCA pump, the nurse must first set the pump for a lockout time of 0 minutes. Next, the nurse will set the volume to be delivered and press the loading dose control button. Finally, the nurse will set the safety parameters. Question number 4. The nurse is caring for a client in acute pain. When assessing the client's quality of pain, which statement will the nurse use? Option A. How long have you been having pain? Option B. Is the pain better or worse at certain times of the day or night? Option C. What words would you use to describe your pain? And option D. Have you noticed any time during the day or night that the pain is better or worse? The correct answer is option C. Quality of pain may be assessed by asking the client, what words would you use to describe your pain? Question number 5. A nurse assesses a client who is experiencing acute pain. Which aspects of the pain assessment are gathered first before the detailed assessment? Select all that apply. Option A. Location. Option B. Provocation. Option C. Intensity. Option D. Quality. And option E. Radiation. And the correct answer is option A, C, and D. For clients experiencing acute or severe pain, the nurse may focus on determining location, intensity, and quality and quickly follow with an intervention. Clients with less severe or chronic pain can usually provide a more detailed description, and the nurse can obtain a comprehensive pain assessment. Question number 6. The nurse is caring for a client who is using a TENS unit for pain management. Which statements will the nurse use when teaching the client about this therapy? Select all that apply. Option A. Make sure and cover the unit while showering or bathing. Option B. When turning the unit on, make sure the amplitude control is set to 5. Option C. With the unit off, plug the lead wires into the battery-operated unit at one end, leaving the electrodes at the other end. Option D. Increase the amplitude until you feel discomfort and then decrease the amplitude until you feel comfortable. And option E. Wash, rinse, and dry the area where you would like to apply the electrodes. The correct answer is option C. The nurse should instruct the client that, with the TENS unit off, plug the lead wires into the battery-operated unit at one end, leaving electrodes at the other end. Question number 7. The nurse cares for a client who wants to try biofeedback for relief of chronic pain. What advantages to this therapy does the nurse recognize? Select all that apply. Option A increases circulation and endorphins. Option B completely controlled by the client. Option C rapid pain relief. Option D redirects energy flow through pressure on meridian points. Option E promotes stress reduction as well as pain relief. And the correct answer is option B and E. Biofeedback is an electric monitoring device that feeds back effective behavior so the client can control internal processes, such as the heart rate. Advantages to biofeedback include the fact that it is completely controlled by the client, and it promotes stress reduction as well as pain relief. Massage increases circulation and endorphins. Ice therapy promotes rapid pain relief, and acupressure redirects energy flow through pressure on meridian points. Question number 8. The nurse cares for a client with chronic pain, who asks the nurse about using acupressure for pain relief. Which statements will the nurse include in the teaching regarding how this treatment works for pain relief? Select all that apply. Option A. The pressure compresses and splints irritated nerve endings. Option B. It redirects energy flow through pressure on meridian points. Option C. The therapy restores structural integrity and balance. Option D. The therapy reduces pain and increases endorphins. And option E. It manipulates muscles and realigns spinal column nerve function. The correct answer is B and D. Acupressure is a therapy based on the traditional Chinese method of acupuncture. This method involves using specific points located on meridians at various places on the body. This therapy reduces pain and increases endorphins. Acupressure does not compress nerve endings. Chiropractic care restores structural integrity and balance, as well as manipulates muscles and realigns spinal. Questions number 9. The nurse prepared, and the correct answer is A, B, C, and D. Body part location affects the physiological tolerance to heat and cold. For example, the back of the hand and foot are not very temperature sensitive. In contrast, the inner aspect of the wrist and forearm, the neck, and the perineal area are temperature sensitive. The size of the exposed body part affects the physiological tolerance to heat and cold. The larger the area exposed to heat and cold is, the lower is the tolerance. Individual tolerance affects the physiological tolerance to heat and cold. The very young and the very old have the least physiological tolerance. Have the least physiological tolerance. Injured areas of the skin are more susceptible to temperature variations versus intact skin. Question number 10. The nurse is caring for 5 clients with acute pain. When considering the use of heat and cold therapy, which medical conditions will the nurse determine require special precautions? Select all that apply. Option A. Diabetes. Option B. Venous insufficiency. Option C. Asthma. Option D. Congestive heart failure. And option E. Arterial disease. The correct answer is A, B, D, and E. Clients with peripheral vascular disease, peripheral arterial disease, and venous insufficiency, congestive heart failure, and diabetes require special precautions during heat and cold therapy, because these clients lack the normal ability to dissipate heat via the blood circulation, which puts them at risk for tissue damage with heat applications. Cold applications are contraindicated for these clients. Clients with asthma do not require special precautions. Question number 11. A nurse cares for a 13-year-old adolescent with a terminal illness. Which client statement does the nurse expect to hear from this client regarding death and dying? Option A. I will go to sleep for a long time and then wake up. Option B. I know that people die with my disease, but I won't die. Option C. I wonder what happens to people after death. Option D. I know people die, but I will defy my own death. And the correct answer is D. An adolescent client fears a lingering death, often fantasizing that death may be defied by acting in reckless behavior, substance abuse, dangerous driving. Number 12. The nurse cares for a client who needs a PCA pump for control of postoperative pain. Which task can the nurse delegate to the unlicensed assistive personnel, UAP? Option A. Pushing the client button if the client is unable. Option B. Silencing the pump alarm while waiting for the nurse. Option C. Reporting specific client observations. Option D. Asking the client about level of pain. And the correct answer is C. The nurse may delegate the UAP to report specific client observations, such as reporting inadequate pain control. Pushing the client's PCA button is administering an intravenous medication and is a task for the nurse only. The UAP should not silence the PCA pump or determine the client's pain level because these involve assessment of the client's clinical situation and should not be performed by unlicensed personnel. Question number 15. The nurse is preparing to use a disposable hot pack on the client for pain relief. Which action will the nurse prioritize as an appropriate task for the UAP? Option A. Observing the site of application and reporting abnormal findings. Option B. Assessing the client's level of pain. Option C. Determining if the client requires additional therapy. Option D. Documenting the client's response to therapy. And the correct answer is A. Application of various heat therapies may be delegated to the UAP. Question number 12. The nurse cares for a client who needs a PCA pump for control of postoperative pain. Which task can the nurse delegate to the unlicensed assistive personnel, UAP? Option A. Pushing the client button if the client is unable. Option B. Silencing the pump alarm while waiting for the nurse. Option C. Reporting specific client observations. Option D. Asking the client about level of pain. And the correct answer is C. The nurse may delegate the UAP to report specific client observations, such as reporting inadequate pain control. Pushing the client's PCA button is administering an intravenous medication and is a task for the nurse only. The UAP should not silence the PCA pump or determine the client's pain level because these involve assessment of the client's clinical situation and should not be performed by unlicensed personnel. Question number 14. The nurse is caring for a client with acute pain and uses the FLACC pain assessment. Which clinical scenario does the nurse recognize as least appropriate for use of the FLACC pain assessment? Option A. Situations where clients self-report pain. Option B. Situations requiring rapid pain assessment. Option C. Clients who are asleep. Option D. Clients who are children. And the correct answer is B. The FLACC pain assessment requires observation of the client for at least 5 minutes before a determination regarding the pain can be made. Question number 15. The nurse is preparing to use a disposable hot pack on the client for pain relief. Which action will the nurse prioritize as an appropriate task for the UAP? Option A. Observing the site of application and reporting abnormal findings. Option B. Assessing the client's level of pain. Option C. Determining if the client requires additional therapy. Option D. Documenting the client's response to therapy. And the correct answer is A. Application of various heat therapies may be delegated to the UAP. Assessing, determining additional therapy, and documenting response to therapy are all reserved for the nurse only. The UAP may observe the site of the application and report abnormal findings.
Question number 16. The nurse assesses a toddler for pain using the FLACC scale. The nurse notes the client is crying steadily with a quivering chin, is kicking, is shifting back and forth, and is difficult to console. What number does the nurse document for the client's pain based on the FLACC scale? Option 8. Option B 9. Option C 10. Option D 11. And the correct answer is B. The FLACC behavioral pain assessment may be used to help the nurse determine the client's level of pain. Assessment is based on findings of the face, legs, activity, cry, and consolability. A steady cry is 2, with quivering chin is 2, kicking is 2, shifting back and forth is 1, and difficult to console is 2 results in an FLACC total score of 9. And number 17. The nurse is caring for a client in acute pain and plans to use a pain scale tool for assessment. What is the major advantage in using this tool? Option A. It allows organization in the assessment process. Option B. It works with the same efficacy among the entire population. Option C. It allows for variation among various cultures. Option D. It can always be performed quickly. And the correct answer is A. The major advantage of a standardized pain scale tool for assessment of the client's pain is that it allows the nurse to stay organized in the assessment process. While efficient in assessing a client's pain, the tool does not factor in cultural variances in perceptions of pain. Most tools may be performed quickly, however, is not universally true. 18. The nurse is caring for a client who is dying. When prioritizing care, which intervention will the nurse provide to meet the client's physiological needs? Option A. Encourage frequent ambulation and deep breathing. Option B. Initiate total nutrition intravenously. Option C. Administer curative medications. Option D. Encourage favorite foods as tolerated. And the correct answer is D. Encouraging favorite foods as tolerated is an important nursing intervention the nurse will perform for the dying client. Number 19. The nurse prepares to perform a pain assessment and chooses to use a standardized pain assessment tool. Place the steps in order for the use of the standardized pain assessment tool. Option A. Assess the client's physiological response to pain. Option B. Assess the client's perception of pain. Option C. Perform a focused assessment. Option D. Document the findings. And the correct answer is B, A, C, and D. The steps to performing a pain assessment using a standardized pain assessment tool is as follows. Assess the client's perception of pain, including location, intensity, and quality. Assess the client's physiological response to pain. Example, changes in vital signs. Perform a focused assessment and document the findings. Number 20. The nurse prepares to apply a TENS unit on a client who is experiencing pain. Place the steps of this procedure in the correct order. Option A. With the unit off, plug the lead wires into the unit. Option B. Insert the battery and test for functioning. Option C. Turn the unit on and ensure the amplitude is set to 0. Option D. Apply the electrodes to the client. Option E. Increase the amplitude until the client notes discomfort. Option F. Slowly decrease the amplitude until the client notes a pleasant sensation. And the correct answer is B, A, D, C, E, and F. Application of the TENS unit is as follows. Insert the battery and test for functioning. With the unit off, plug the lead wires into the unit. Apply the electrodes to the client. Turn the unit on and ensure the amplitude is set to 0. Increase the amplitude until the client notes discomfort. Slowly decrease the amplitude until the client notes a pleasant sensation.